Hello, this is Dr. Lewerenz, Lewerenz Medical Center and Longevity Health Institute. Bringing you a message actually today on a Saturday. Actually working in the office in March, late March here in the middle of our COVID-19 pandemic. And I know I've brought to you a few things and talked to you about a few things that are nutrients that support your immunity. And you're well aware already, not just from me, but around the world and on the news and the media, etc., about certain things that can help prevent you getting an infection like the COVID virus. Hand washing, face touching, social distancing, etc. So here's the thing though, is I'm going to hit a couple big things that are some foundational systems that are important for your immunity. And I'm going to hit some big things here that are actually some hormones and amino acids that play a huge role into your immune system. And I think they really, really, really matter. And when you're talking about all this stuff and the panic and the fear of what's going on here, we know three things are related to and have been shown to be a common correlation with the severity and severe cases of respiratory distress and failure and needing ventilation with COVID-19 infection is if you're a diabetic, if you're hypertensive, and if you're obese. Now I'm going to put in there, just because of China is actually related to a big portion of their infection rate and actually difficulty with respiratory issues, and the escalation of the infection was with smokers and then assumed COPD. So we'll put that in as a fourth. But if you can do things that boost your immune system, and if you can do smart hygienic things, social distancing, stay home, wash your hands, protect yourself from touching your face, quarantine when needed and seems appropriate, I should say, sick, runny nose, fever, cough, chills, feeling under the weather. Even if you're just staying at home, I think that's very important not to expose other people, even at the grocery store, etc. So here's a big thing: have somebody else shop for you, okay? At least for till your thing passes. 87%, and I know these numbers all vary because it's based on how many people get tested, but 80+% of screening tests for COVID-19 are non-COVID-19. They're negative. Okay, not to make light of it at all. But here's the thing: is this. So you always hear me in a primary care functional integrative way. You want to fix systems, two main systems. And I'm going to throw in a minor third one, but two main systems are huge related to your immunity, okay, in your foundation in your body, whatever age you are, whatever gender, it doesn't matter. And that is your gut health, which is a 70+% of your immune system, okay, and your hormonal system, particularly your adrenal hormonal system, and I'm going to throw in another hormone there. So there are studies that show this. But you can resolve a lot of immune issues. So I had a few phone calls today I had to address with patients about they're worried about their immune system. They're not that elderly. They're actually, one was in their 20s, one was in their 40s, and they're actually really concerned about, hey, I have allergies, I have asthma, I get sick very often, and this time of year especially, coughs and colds and allergies. They have asthma, etc. So they wheeze, and so they have some big concern. And we're doing some things with them in a way of predicting that they don't develop anything, and that's just on the end of making sure that they have their inhalers and their bronchodilators, etc. But here's the big thing: is your diet, what you put in your body, is huge. So stay away from dairy, it's inflammatory. Stay away from gluten, it's very sensitive and allergic and reactive, it's hard to break down. You create inflammatory reactions at the digestive lining, okay? You're causing your immune barrier to be dysfunctional, and you're affecting your Th1, Th2 immune system, which makes you produce these inflammatory cytokines, and that affects your immune system. Anything that's going to downregulate your immune system is going to make you more prone or suspect to fighting any infection, okay? So vegetables, fruits, nuts, seeds, lean proteins, a lot of beans and legumes. Stay away from gluten and dairy. Okay, I don't care if you believe in that or not as far as everybody's allergic or sensitive, but it's a big thing related to your immunity and digestive inflammation. The other thing is take a good quality probiotic. You've heard me say this many times. High dose quality probiotics, multi-strain, they have huge immune effects on your body, okay? The other thing is, digestively, is you want to make sure that you're on a few supplements if you do have underlying digestive stuff, reflux, GERD, heartburn, IBS, bowel issues, etc. Most people want to be on a probiotic, but you should also be on an amino acid called glutamine. Glutamine helps the epithelial cells in the digestive lining regenerate, okay? So if you can reestablish that barrier in your gut and re-flourish the gut flora with probiotics and eat healthy, your immune system is going to be stronger and better to fight anything, okay? Any infection, virus, allergies, etc. Okay? The other thing is on the other foundational system that's huge for your immune system is your hormones. Now, there are studies and there are some, I will tell you clinically here, we see a lot of benefits when you limit insulin resistance, a hormone, insulin's a hormone, so you control sugars and diabetes or prediabetes, and this is with everybody, anybody, not even just a diabetic, and you see immune benefits, okay, in somebody that has a moderate or optimal testosterone, men or women. You don't want to be testosterone deficient, whether that's taking something naturally to help you produce your own testosterone, which we do here at the office, and or you're on some type of bioidentical hormone replacement, okay? You tend to have a higher immune response. Plus, this all works together, okay? People that have more optimal testosterone have more insulin sensitivity, so their blood sugars stay down. Your blood sugars stay down, you're less in that diabetic range, and you're gonna have a higher immune response and able to fight things like infections, etc. So those are big things. Now, the other hormonal factor that plays a role, is a big one, is the stress hormone. Cortisol, your stress hormone, and DHEA, your underlining, kind of, if I call it your brake or your governor to your adrenal system, okay? You need DHEA to have a higher immunity. You want at least a mid to moderate DHEA level. So if you're over 35 or near 40, very likely I would tell you to supplement with DHEA. I love 7-keto DHEA because it's a clean part of your adrenal hormone and it doesn't turn into other hormones. But not to get too long-winded, but your adrenals need to be calmed, whether that's taking an adaptogenic herb, whether that's supplementing with DHEA, and most importantly is getting sleep. So you need 8 hours of sleep. If you feel stressed and anxious and worried right now, and totally understandable, and that's fair, but have faith, love each other and pray, and have a atonement and a commitment here to do the right thing to yourself and others around you, and this will work out. And here's the thing is that when you sleep well, like I was saying earlier, and you maybe meditate, use yoga, things that are calming your autonomic nervous system, you calm your adrenals. And we're in a tough time here where you can't get a lot of external things to cause enjoyment, and get out and about and socialize, etc. But get on FaceTime, get on your video phone and interact with each other. I was on a 3-mile walk this morning with my dogs, saw a few people. I literally, that lifted my spirit to just see a few people and wave and say, how you doing? Beautiful day. I know it's really cold and brisk, but that's super, super important, okay? And that has immune effects on you. No joke, I said this in a previous video, I think in one of my live videos. Intercourse, sex, intimacy, that boosts your immune system. Maybe even just giving a hug or a kiss. There's been shown that oxytocin goes up when people hug and kiss and have some love and passion with each other. That has immune effects, okay? So there's many things that you can do that help your immune system even without supplementation, okay? Now, one side note here is we do a therapy here that is called peptide therapy. And basically they're chains of amino acids that are injectable that have a effect on the body to help the body signal to produce things. Well, there's a couple peptides, that are very effective in boosting your immune system. One is a thymus glandular extract called thymosin alpha-1 we use here, and we use it usually in our autoimmune patients or our cancer patients, but you could use it in any patient that has allergies, asthma, weakened immune response, lower white blood count, neutropenia, low white blood cells. Have a few patients like this week I saw. We're trying to use some things to boost to get their white count up because of the times that are going on with COVID-19. And but peptides, including a few others like imipramolin and CJC 1295, but particularly thymosin alpha-1, that peptide is lovely to give you immune benefits. Simple injection 2-3 times a week, sub-Q in your fat, and you actually get a higher immune response to pretty much everything. So there's many approaches that we do integratively here, and I think what's really important is that you incorporate these thoughts of how you live, how you sleep, what you take and put in your body, and then if at all needed, supplementation, whether that's a hormone or a supplement or at times even medication. So I'd like to remind my followers out there and my patients and tell others, we are a primary care practice. We are a integrative practice where we integrate the best of Eastern and Western medicine. But as an integrative practice, we do real medicine. So we're doing blood, we're doing live blood cytology, we're looking at your body, head and toe, and many things we treat are everyday things that still need to be addressed on a day-to-day basis. So our doors here at Longevity Health Institute and Lewerenz Medical Center are continue to be open every day, and we practice very hygienic CDC clean guidelines. We are not bringing in sick people. We would like to keep the well and boost their immune system. And if somebody's got some illness, we do telemedicine, and if they have concerns about coming in, we do offer telemedicine consults on the phone every day. And we're still doing our typical needed and necessary procedures in the office as well. So we are here, we are open, and business somewhat as usual because we want to keep you well. A few other things, just as a reminder out there, if you're our patient, all our supplements you can order, all our vitamins and supplements you can order on our warehouse, on our supplement shop on our website, and you can actually just click on that, and the password to get access is health. You can also call our office any day, and most of you do lately this last week. We will actually take your supplement order and process it, ship it, or excuse me, not ship it, excuse me. We will ship it out to the parking lot, bag it, and actually bring it out to you in the car so you don't have to risk coming in or getting out of your car. And we continue to do that every day. In fact, that's been a very, very big help, and patients really appreciate that. But listen, don't ignore your medical stuff, your medical symptoms. Don't ignore anything, and don't be afraid to seek medical help. Doctors are open. I'm part of Michigan Healthcare Professionals. Doctors are open, and the doors are open, and when needed and appropriate, they're doing telemedicine. And here's a big thing is that you got to take care of yourself so that you can take care of your elderly loved ones. I've already dealt with that on the phone, trying to give some counsel to patients. What do I do? My mom's alone, my dad's alone, and mom's alone. They have some illnesses and some conditions, yet they're concerned about contaminating the environment. So you got to be smart about it. And maybe deliver food to the garage or on the porch, etc. But every case is unique and has to use some common sense and also some love and care. So we will get through all this pandemic together. It will change and change us to some degree because these types of things do leave scars and leave wounds. But we are strong, and just like we've been here for 22 years, myself, Dr. Lewerenz, Longevity Health Institute, Lewerenz Medical Center, we are here passionately to care for you and provide the best in primary care medicine, functional medicine, integrative medicine to keep you well and keep you on the best healthy course to live the best. Quality and optimal is always our goal. Plus, currently right now, keeping you out of the ERs, keeping you out of the hospital. Okay, and I feel we do a very good job of that. So, again, give us a call. We'll get you in. We'll create a telemedicine visit. Go to our website for any supplements, or we have them here. Fortunately, we're still very well stocked, and don't be afraid to reach out to our office and staff, because that's been a common question, if we're still open here and still business as usual, and we are, and happy to be and grateful to be. We're grateful to be here and helping you. So this is Dr. Lewerenz. Hope that's informative. Remember, take care of your immune system. Be smart. Wash your hands. Keep your hands off your face. Think of cleaning things around you that you use repetitively. And take care of your gut. Take care of your mind and body and stress and those supplements I mentioned. God bless. Be well. This is Dr. Lewerenz.